Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Dr. Stephen Cattaneo. He is a thoracic surgeon for Anne Arundel Medical Center. You're also the medical director of thoracic oncology.
That's right. And thank you very much for having me here, Stephanie.
Today we're discussing lung cancer. And we're talking about how a person can get lung cancer and some of the treatments that are now available and early screening for lung cancer. So most of the people who get lung cancer, is it mainly from smoking?
Yes, it is. Smoking is by far the biggest risk factor for lung cancer, but there are plenty of other risks. Our lungs are open to the environment, and so many exposures, things like secondhand smoke, radon gas, certain heavy metals, and other exposures we think increase the lung cancer risk. But smoking cigarettes is by far the biggest known risk factor.
We know a lot more now about smoking than we did many years ago.
Sure.
But people are still not getting diagnosed until the latter stages of the disease. What's going on?
Yeah, so we do know a lot more, and it's been since 1964 when the Surgeon General first put forth evidence that smoking cigarettes caused lung cancer, and we've learned a lot since then. People are generally cutting back on how much they're smoking, and many people have learned how to quit, but the problem with lung cancer, one of the problems with lung cancer is most people don't have any symptoms, especially early on, and so they're completely unaware. And maybe they quit smoking 30 or 40 years ago, so they don't even, it's not even on their radar anymore. And so, it's not like they suddenly have pain in the chest or they start coughing up blood, but really until lung cancer gets fairly far along, and patients start to lose weight or they start to feel really tired or lethargic, that's really when people are figuring out that something's wrong. And by then it's typically too late.
So you're saying you could have quit smoking 20 or 30 years ago and you're still at a high risk?
You're still
I thought it was 15 years.
Yeah, 15 years is a kind of an accepted cutoff. Once you quit smoking, your risk starts to drop. Does it ever quite get back to where it would have been if you never smoked? Not quite, but it does get a lot lower. So stopping cigarette smoking and other substances is by far the best way to cut down your risk of lung cancer. But you never get back to where you were as if you'd never smoked.
I started smoking when I was a teenager, and it took me 20 years to quit, but I did. During that time when I was trying to quit, smoking was not fashionable. You had to hide somewhere and smoke, go outside and smoke in 30 below weather, things like that. But it seems like the trend has kind of circled back around, and I'm seeing a lot of young folks smoking. You would think with all of the information out here today, why would someone start smoking?
Yeah, that's a great question. And by and large, for most age groups, people have been cutting back on smoking. And now the rates are as low in this country as they've been in many decades, down to about 15 to 18% of folks are active smokers. But the one group that's increasing is the young, actually teenagers, early 20s, are picking up cigarettes more frequently than they used to be.
What about the electronic cigarettes?
That's a great question, and the jury's still out on are there going to be some benefits to electronic cigarettes or not. Right now there is no recommendation, there's no FDA approval, for example, with electronic cigarettes. Part of the problem is, and the FDA is under the process right now of reviewing and putting forth some regulations as to what goes in, because there's chemicals, there are different vapor exposures that there are concerns that they could also cause problems such as lung cancer. Not proven, but those are some of the concerns. Certainly people have been poisoned by the products that are put into the electronic cigarettes. And so we have to be careful. More information, more data is going to be necessary to really decide how safe are they, when are the right circumstances that people might consider using them, etc.
The dangers with cigarette smoke is in the nicotine.
So the nicotine is actually what is addictive within the cigarettes, but there are hundreds of compounds, many of which are carcinogens or cancer-causing compounds that are in cigarettes. But the nicotine is more of the addictive substance as opposed to the one that's necessarily causing the cancer.
Let's just say that you have been diagnosed with lung cancer. Many years ago, that was a death sentence.
Sure.
Nowadays, there are more treatments available than, of course, there were 20, 30, 40 years ago. Tell us what's going on in the news world.
Sure.
Cigarettes.
Well, you're absolutely right. There's been a number of advances with management of lung cancer. Part of which is we're finding them earlier, in part because of screening and other ways. But even when someone is found to have lung cancer, our treatments have gotten better. Surgeries become safer, it's less invasive, the recovery's faster with less complications. Chemotherapy drugs and other immunotherapies and other medications that many people have heard of, even just on television now, they're being advertised, have gotten more effective. It used to be that if you had lung cancer, this was your treatment. You would get chemotherapy and radiation, and it was pretty much the same no matter what type of cancer you have. Now it's gotten a lot more individualized because there are different molecular changes within the tumors. There are newer medications that can target those molecular changes, and not only are they more effective in many instances, but the side effects are not as bad as traditional chemotherapy. One more thing, radiation has also gotten more effective. And so traditionally radiation for lung cancer and other cancers was given over approximately about a 6-week schedule, but now it's gotten much more specific. The tumors are able to be targeted with tighter radiation fields, so it's cut down on the toxicity and even the length that people require radiation therapy in some circumstances.
How has the screening changed?
So screening is a huge new thing for lung cancer. In the past 5 years or so, it's really come to fruition. And for decades, there have been many researchers looking for ways, if lung cancer doesn't show up until it's really advanced, how can we figure out? We know who's at risk by and large, it's the smokers, so how can we figure this out? So they tried doing chest x-rays, people tried, getting sputum samples to see, is there any way you could tell if someone had lung cancer? But it wasn't until a big trial funded by the National Cancer Institute that came out about 5 years ago that showed, the name of the trial is the National Lung Screening Trial, and it showed that there was a benefit to doing low-dose CAT scans in the highest risk people every year for 3 years to determine if they had a spot that may or may not be lung cancer.
Who is considered high risk?
So the current recommendations are patients or persons that are 55 to 74, based on the National Lung Screening Trial, who either currently smoke or quit smoking in the last 15 years, and have smoked the equivalent of 30 pack years. So a pack year is a pack a day for a year is 1 pack year, so 30 pack years is a pack a day for 30 years, or 2 packs a day for 15 years, half a pack a day for 60 years, some way to get a multiple of 30 or more. Those are the folks considered at the highest risk for lung cancer. And those are the ones that are recommended to undergo yearly low-dose CT screening of their chest.
Are there any genetic components involved in lung cancer? In other words, if your father got lung cancer, are you more likely to get it even if you didn't smoke? Or
we don't know terribly much about the genetics of lung cancer like we do for breast cancer and for colon cancer, but clearly their genetics do play a role. Family history of lung cancer is certainly a risk factor, not nearly as significant as if you smoked yourself, but certainly there's some risk involved. There are families who everybody smokes and nobody gets lung cancer, and then there are some families who nobody smokes and everybody's getting lung cancer. And some of it is genetics and some of it is exposure, because if you're exposed to a lot of cigarette smoke in the household, then that's going to put you at higher risk. Or if you're a family who lived near a significant radon exposure, then that's going to put everybody in the household at higher risk. So genetics does play a role, but it's not quite been teased out exactly yet.
How old should you be when you start getting tested? We know how old you should be when you start getting tested for breast cancer. And is there a particular age?
Well, right now it's 55 is the official recommendation based on the National Lung Screening Trial. However, the National Comprehensive Cancer Network, or NCCN, is a group of experts in the field who have really sat down and thought about lung cancer screening. And there are some recommendations that even slightly lower risk patients, maybe who are 50, who have a family member who has had a history of lung cancer, who has smoked, who has had exposure to radon or heavy metals, that they should also be screened. And so really the best way is to talk to an expert, a local expert who is involved with lung cancer screening, to find out what your risk is and whether you should be screened. The downside of screening, because there's a lot of benefits to screening, and we know we can find lung cancers and other findings within the chest that we can help save people's lives, but there's exposure risk to radiation when you have a low-dose CAT scan. There's anxiety where you find a spot on your lung. It may or may not be important, but that causes a certain amount of anxiety. And so there's other risks to screening. And so it isn't as if we should just screen everybody. It really is important to sit down and have a conversation with a healthcare professional who takes care of people who potentially should have lung cancer screening to really get an understanding of your risk. We also have a health risk profiler for people that are interested, where they can log on to the website. It's askaamc.org/breathe, and they can access the lung health profiler that kind of takes you step by step through these questions. How old are you? How much have you smoked? Do you have any family members who have a history? So they can really start to get a sense, he or she can really get a sense as to what their risk might be.
Well, let's talk about the program that Anne Arundel Medical Center has set up for people of Prince George's County.
Okay.
So it's called the Breathe in More Moments program. Can you
Yes.
tell us about that?
Yeah, sure. Thank you for asking about that. We've been screening participants for lung cancer for about 5 or 6 years now, and have had tremendous success with finding early lung cancers and helping people. Part of our experience, however, is that you can't just have people get low-dose CAT scans. You have to have a program around, well, what are you going to do with the findings that you see on the scans? Most of the findings we see on a scan aren't actually lung cancer, but it's just a small spot that was related to an old exposure that really isn't important. But you've got to be able to work through and figure out what's important and what's not important. And this is really a big multidisciplinary effort that is done between the pulmonologists, the oncologists, the surgeons, the radiologists, et cetera. And so that's just a piece of our program. We have managed, though, the Breathe in More Moments campaign is part of a grant that we received from the Bristol Myers Squibb Foundation, who is helping different programs around the country reach more numbers of folks, reach vulnerable populations. So not just people who smoke, but maybe patients and people that are at higher risk. So they have a lower socioeconomic status. We know that people with lower socioeconomic status or lower income level smoke at a higher frequency. And so, or people with lower education smoke with a higher frequency. And so they're probably at higher risk than other populations, but we aren't necessarily as good at reaching out and finding those patients and talking to them and working with them and helping them figure out if they have lung cancer or not. And so the efforts of the campaign is to just, it's awareness. It's about making sure people understand what their risks are and who's eligible for screening.
And why did you choose Prince George's County? Is there a particular issue going on in the county? Is there a higher risk in the county for whatever reason?
Yeah, so no, I mean, Prince George's County, and number one, Anne Arundel has quite a relationship with Prince George's County. We're also working with Calvert County and Anne Arundel County, of course. Some of it is about the risk, although the latest numbers from Prince George's County actually look pretty good. Prince George's County's risk overall, the population risk of lung cancer is a little bit lower than the statewide average. But certainly there are groups of the population, as there are in every county, who are at higher risk. And so that's in particular why we're looking at this area. You asked earlier about the genetic components.
Yes.
We also don't know much about, well, are there not just genetic, but are there, racial genetic issues that might make African Americans, for example, at higher risk? There doesn't seem to be. And the rates of lung cancer in African Americans, if anything, are slightly lower than for Caucasians and for other populations. Again, reasons not completely well understood. Some of it has to do with exposure, because the smoking rates are also a little bit lower oftentimes in African American populations.
We briefly talked about the fact that you can get lung cancer without being a smoker, or if you quit smoking 15, 20 years ago. What if you never smoked at all? Especially, and before we answer that one completely, secondhand smoke, that is frightening, that you could get lung cancer. You've never put a cigarette in your mouth ever in life, and you can still get lung cancer from secondhand smoke.
Sure. After smoking, secondhand smoke is probably the next most important risk factor. It's very difficult to know. It's hard to know when someone's smoking, how much are they really smoking? You know, how much do they inhale? Do they leave the cigarette sitting in an ashtray the whole time, or are they really smoking the whole cigarette? So you can imagine how hard it is to tell how much secondhand smoke did somebody get. It's very challenging, but clearly there's risk. And folks who have never smoked who get lung cancer is actually in the top 10 of cancers that people get in the United States. And so it is becoming an increasingly common problem that we're recognizing. And so it's a challenge, right? Because what do you do with folks who've never smoked? Their risk is not very high, but it's not zero either. And so part of this, again, is awareness and, you know, making sure that people understand just because you've never smoked doesn't mean you can't get lung cancer. And so part of our efforts are not just to educate the population through our campaign and other avenues, but also the primary care physicians. If you have a young woman who has a cough, most coughs are nothing, of course, I don't want to make people nervous, but a cough that just doesn't quite go away, it lasts for months, you can't forget about the fact that young people who've never smoked can still get lung cancer. It's rare, but it does happen.
If you were to name 5 things to bring awareness to people right now, if you can name 5 things that people should look for when it comes to smoking and the possibility of getting lung cancer, what would you say?
As far as awareness as to whether they might have lung cancer?
Or what to avoid?
Well, smoking, number one, you know, and there are lots of resources to help. You know, quitting smoking is one of the hardest things that people have to do, and maybe you know that from experience.
It is really to the point where for years I wouldn't try because it seemed that much of a mountain to climb.
Yeah.
But you just have to do it.
You do. A lot of it's a mindset, and I talk to all of my patients about this. You know, if you're not in a place where you're ready to quit, it's very hard, because it's not like we're going to put a patch or give you gum, or there's newer medications like Chantix has been a wonderful drug for some people. Those things don't make you not want to smoke. They just kind of help you either get over the nicotine addiction, or help get through some of the anxiety around the smoke, or not smoking. But you have to really want to quit if you're going to do it. But there are a lot of resources, and the state of Maryland provides resources through the county health departments. And so here in Prince George's County, there's access through the health department and other professionals that can help people quit.
So now you have the gums. You have different medications that you can take, pills or whatever.
Right.
And the patch you have as well. Do you find that those things have been successful, or have they just kind of been a slight deterrent, but you've got to really want it?
You got to really want it. A person's ability to quit smoking is very personal, and because people have also benefited from hypnosis, from group therapy, from just different ways. So it isn't always the patch or the gum or a medication. And really part of the tobacco treatment specialist's job is to really sit down with a person and work with he or she and try and figure out what is the right way to go about this. But you're absolutely right. It's got to start here before any of those other things are really going to help very much.
Have you found that there are any side effects from the things that can help you quit? Meaning, are there any side effects from the gums? Are there any side effects from the patch?
So the nicotine replacement, the gum, the patch, there don't seem to be too many side effects. A little bit of irritation maybe on the skin or things like that, but nothing too bad. I think the medication that's been the most helpful for a lot of folks has been Chantix. And Chantix has some side effects that really make people nervous about having really vivid dreams, et cetera, and that's gotten some people to quit just because it made them uncomfortable. But for a number of people, it's really been a miracle drug to help them quit.
And you were going to name those things that you would tell a person as far as prevention goes.
So stop smoking if you do. Get away from smoke. So fortunately, there's been so many laws passed now where most public places no longer allow for smoking. But if you have a family member or somebody who's smoking in the house, if you can't get them to quit, get them to do it outside, away from you, or you remove yourself from the situation. Try and avoid the secondhand smoke. Be aware of your body, be aware of your lung health. And so if there's something that seems to be changing about your breathing, or you have new symptoms of a cough, or you're bringing up some blood or something like that, that doesn't mean you have lung cancer, but it's something that you need to see your primary care physician.
The cough is huge.
It can be. It can be. Cough is caused by so many things. Lung cancer is a very small minority of it, but lung cancers can make people cough too, so you have to be careful.
And so that's one of the major signs as well. Is there some other signs? Might be breathing difficulty?
It can be, but again, an early lung cancer, so it's just a small spot in the lung, essentially you have no symptoms whatsoever. And that's where the value of screening comes in, because you're screening a person who is at risk but has no symptoms, and that's where you might pick up something very early. As you said very appropriately earlier, most lung cancers still are not found until the later stages, and that's when it's moved into the lymph nodes, or maybe someone presents or develops hip pain because the lung cancer's moved to the bone in the hip.
Doctor, where else can it spread?
So lung cancer most commonly spreads to other parts of the lungs, in the lymph nodes like we were saying. It can go to bones like the hip or the spine, the liver, the adrenal glands, which sit on top of our kidneys and make hormones like adrenaline, which is what they're named for, and then the brain is another common site. But again, it's unusual for people to develop neurologic symptoms or a stroke or something like that, and we find out they have lung cancer. It's usually much more subtle than that.
Is there an age limit when it comes to screening? And I hate to say this, are you ever too old to get screened?
No, that's a great question. So screening, the National Lung Screening Trial covered through the age of 74. However, further research has demonstrated there may be a benefit up to 80. So we actually screen patients from age 55 to 80. And if that meet the criteria we talked about earlier, they're still smoking, they quit in the last 15 years, they've smoked the equivalent of 30 pack years. Where age becomes important is how healthy somebody is. So if someone is 60, but they have really severe heart disease or other problems that the least of their worries is whether they have an early lung cancer or not, they probably shouldn't be screened. If someone's 79 or 80 and they're robust and they're taking care of themselves, they're active, they're independent, that's probably somebody who should be screened, because if an early lung cancer is found, they've still got a lot of life in front of them, and so we want to do something about that.
In our last few minutes, let's go over one more time talking about the Breathe in More Moments program. Anne Arundel County is reaching out to people to get them more educated when it comes to lung cancer. Can you make sure we mention that again?
Sure. So the campaign really is about awareness, and it's for the primary care physicians and really for the population of Prince George's County, Anne Arundel County, Calvert counties, and just trying to raise awareness about lung cancer and really the most important preventive measure, which is to quit smoking, and then the efforts around screening and helping people who are at risk learn what their risk is, learn that they can undergo a low-dose CAT scan that can potentially help find an early lung cancer. And so it's really getting the information out. Lung screening's only been done for the past 4 or 5 years, and still many people are just unaware that there are tests out there that can help save your life.
And it's not something that's invasive, the different screening procedures. It's not like surgery.
No, not at all. And as we talked earlier, there are some risks which a medical professional can sit down and talk to people about. But no, the low-dose CAT scan is very easy. It takes a few moments. You don't even have to get undressed. You just lay down in the scanner, take a deep breath, and the scan takes about 5 or 6 seconds.
Because Dr. Cattaneo, when you say screening, sometimes people think of things like an MRI where you go in
right.
It's not that.
No, nothing like that. It's very quick. Even people who are claustrophobic usually do okay in a quick CAT scan. And so it really is a very simple thing and can be life-saving.
And one more reminder that the electronic cigarette devices are not a great replacement for cigarettes.
Not really. There have been some persons who have used them and feel like that was kind of their step down from cigarettes to electronic cigarettes to quitting altogether. there just is, even though it worked for one person, doesn't mean it's recommended for everybody just yet. And I think as we learn more about the safety of electronic cigarettes, there may be a role to help people quit smoking with electronic cigarettes, but right now they're just not recommended.
And what about those hookah things?
Yeah, same thing. Anything that is letting out smoke and has chemicals in it, and so you're bringing those down into your lungs, and not only can they potentially cause cancers, but it injures the lungs, it causes inflammation. Down the road, people might have problems with asthma or other reactive airways diseases. There are lots of potential downsides to inhaling any kind of gases or chemicals into the lungs.
And last but not least, what can people do to improve their lung health? Vitamins, anything they can do, or more exercise, or what are just a few things you can do to improve your lung health?
Yeah. So I think you hit upon a big one. Exercise is huge, because really active aerobic exercise, even if it's 30 minutes of walking 3 or 4 times a day, just getting out and being active is so important for lung health, for heart health, and other parts of the body. Avoiding cigarettes, like we say, like I said, staying away from secondhand smoke. There aren't really any vitamins or any other known ways to help the lungs necessarily, but those are other ways is just really staying active.
Very good. Thank you so much for joining us today. We've been talking to Dr. Stephen Cattaneo. He's the Medical Director of Thoracic Oncology at Anne Arundel Medical Center, and we've been talking about lung health. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.